Hi everyone, welcome back to our live Facebook feed here at the CRAs this year. My name is Katie LeBlanc. I'm a patient partner with the Arthritis Patient Advisory Board of Arthritis Research Canada. And today we're really pleasured to have Dr. Jennifer Reynolds with us. She's a clinical assistant professor in the Department of Medicine at UBC. And it's extra special for me today because she's my rheumatologist as well. So we do have a relationship going back a few years. So Dr. Reynolds, can you tell us a little bit about yourself and how you're involved in rheumatology?
Sure. So I work at the Mary Pack Arthritis Center. I have a private practice clinic there, and I also direct the Lupus clinic, which has moved around over the last few years. It used to be at St. Paul's, and then it's gradually made its way back to the Mary Pack Center. I still do my clinical call over at St. Paul's, and I do a traveling clinic up to Prince Rupert, so I get around the rounds a little bit.
Mm-hmm. Nice. And from the CRAs here and over the past year, what have you noticed are the major developments or trends in rheumatology?
I think there's more discussion than before about improving access to care and how we can do that in different models of care. In the lower mainline, we've actually had a nice little boom of rheumatologists that we've trained and graduated, so things aren't quite as bad in Vancouver proper, but I think as your last speaker was talking about, there's lots of underserviced areas, and I certainly see that when I go up north, and I think we're going to have to look at more innovative ways of trying to get out and reach patients that way. Scientifically, it always seems to be little incremental things that come forward and change practice. So some diseases I think are moving really quickly. So some of our inflammatory muscle diseases have changed a lot. Giant cell arteritis is new and exciting with new treatments these days. Other more popular, I guess, more common rheumatic diseases haven't seen as much change, I don't think, but we're always making advancements as we go forward. So lupus-wise, unfortunately, we don't have anything really new and exciting in terms of treatment, but I got to come to a meeting just before the CRA started with a group called CANIOS, which is the Canadian Network for Improved Outcomes in Lupus. And there's some really exciting stuff that's coming through there. One of the researchers from Quebec is doing some really nice work about giving patients access to more information on the internet through an interactive navigator. And he's currently doing it in a research format, but I'm really hoping over the next 6 months or so, that'll be something that patients across the board can access, which will be really useful for them.
Yeah, especially for more rural patients who don't have as much access to rheumatology clinics, having online resources is becoming a big topic this year.
And especially for lupus patients, because the disease is so variable, that sometimes it's really hard to know what of the information on the internet you can rely on, and then how much of it applies to you, I think, is an even bigger issue for lupus patients in particular. And so that's the hope with this, that it's more tailorable to an individual person, and they can look for information that really matters to them.
Interesting. So what do you think, looking ahead for the next year, will be maybe the big trends or the focus in rheumatology?
So I think there'll be a little bit. We heard Linda Lee give her presentation about patient wearables and some of the big data that can come from patients being more involved in their healthcare and being able to access some of those internet-based platforms. So that's something that I haven't explored very much, and I found fascinating. She had an example of 30,000 lupus patients who have enrolled in patients like me, and I think that's a really useful way of finding out what's maybe more important to patients than researchers or clinicians, and trying to have a more patient-centered approach to some of the research and things that we're looking forward to. So that's something I think we'll see, maybe not over the next year, but the next few years.
Yeah, I've noticed for sure some of the main themes this year are listening to the patient voice, having the patient as an active participant in the research. So I think that's going to be a big trend moving forward. And that kind of ties into this year's meeting theme, precision and personalized medicine. So do you have any thoughts around that theme?
I love that theme because I think everyone wants to have the right medicine for the right patient at the right time. And I think particularly for something like lupus, where the disease is so variable, it's really important to do that for our patients. I mean, it is for everybody, but some diseases are more suited to sort of flow sheet type approach, whereas something like lupus, you really need it to be precise and directed to the individual patient. I loved the presentation from our speaker from Australia about the potential for vaccinating and preventing disease. I think that was one of the most exciting things that I've seen come forward for a while. Obviously, that's something that's going to take a few more years to see come to fruition, but the idea of identifying patients and being able to not only treat them, but potentially prevent the disease in the first place is totally new and exciting.
Yeah, the field of genetics is going to open up a whole new way of looking at healthcare in the future. And what do you think is the most exciting or maybe important thing that has come so far from this year's CRA? I know there's been a lot, but if there was one exciting thing you had to take away.
Oh, I think it probably was that vaccination study. So she's able to identify high-risk patients, and it's still really early stages, but the idea that fundamentally getting to the roots of the problem in the immune system and being able to turn off the disease before it starts, as opposed to, even when we're really good at treating a disease, patients mostly have to take disease for a really long time. You and I both know that another approach to that is sort of really in-depth lifestyle changes.
Yeah.
And so that I think some of that's coming through too. I think, unfortunately, because I see a lot of patients who don't make those lifestyle changes, I'm not sure that that's going to be a successful approach for everybody. I think we need to have a variety of approaches out there. And it's really fascinating to see some of that come through, in addition to the big bucks and new drugs that we always like to have at our disposal.
Yeah, it's exciting to see some of the lifestyle interventions that are being discussed, including nutrition and exercise, and making that an important part of your everyday life and part of your toolkit when you have arthritis. So how do you think arthritis models of care will advance in the near future if we're talking about these different modalities of our management toolkit?
I think they're going to be variable depending on the patient that you have. So some patients are really motivated, and I think some of the interactive tools are going to allow them to have a lot more say in how they are managing their disease, how frequently they need to see their physicians. You know, if they're doing really well, they can interact in, maybe on a technology platform without having to have those clinical visits. I think there's other patients who really need the hand-holding, and they're going to need more regular clinical visits and something more closely associated with our traditional model that we're doing right now. But I think with some of that flexibility, hopefully with some technology in there to help support physicians, that we'll be able to see people in a different way and more tailored way going forward, which would be really exciting.
More precision-based.
More precision, yeah.
And just to wrap up, do you have any lifestyle tips to offer our audience from this year's CRAs?
I think there was a lot more positive data coming out of the nutrition talk that I went to. So again, some patients were really motivated to make big changes for their nutrition, but even small changes that patients can make, things that they can add, vitamin D as a supplement and little things like that. I think there's always something that patients can do if they're interested on that front. I was a little disappointed with some of the exercise data. There was just a little bit that came through with the osteoarthritis, and it didn't really look like patients were sticking to their original goals in terms of exercise. So I think there's room to improve on that. A combination of different lifestyle things. But I also think when I tell patients, even if they've made these lofty goals and then they get disappointed because they haven't lived up to them, any little change makes a difference, and then you just build from there and move forward. So not to be discouraged by a setback.
Yeah, it was really interesting to hear some of the information coming out on nutrition and basically focusing on a more whole foods diet as much as we can help some of our inflammation.
It's fascinating what the science is learning about in terms of what we're eating and how we can influence our immune system. Probably not a surprise, and hopefully that will translate into better, clear information for us to give to our patients.
Yeah, so lots of exciting things coming up for sure.
Absolutely, absolutely.
So do we have any questions from the audience?
There is a question that's specific to lupus. What are the lifestyle changes you would recommend for a patient living with lupus? As well, can lifestyle have a significant impact on the disease?
So I think that there's a little bit of evidence that lifestyle can have a huge impact on lupus patients. In terms of the nutrition, I think it's always difficult to make a general statement, but a healthy diet, which these days is leaning towards a Mediterranean diet, lots of fish, fresh fruits and fresh vegetables, is a really great approach, and that can make a huge influence on your levels of inflammation, which is great. What was the other part of the question?
Can lifestyle have a significant impact on the disease?
And it certainly can. We also know that unfortunately a lot of lupus patients have other conditions, comorbidities, and diet, exercise, getting adequate sleep can have a huge influence on those as well. So a lot of depression, anxiety, headaches can be helped with a lot of those lifestyle modifications.
And because you're both, you're a patient and the rheumatologist, so there's a question about what makes a patient-rheumatologist relationship work very well. I guess we want to hear from both of you.
Yeah, sure.
You go first.
Well, for me, it's having someone who can listen and understand the approach that you really want to take with your care, and having an open conversation about how you want your disease management to look like in the future, and then just being open and honest about any lifestyle modifications you're doing so that everyone is aware and we can all move forward at a safe pace. So that was really important to me and what I really appreciated with Dr. Reynolds.
And I would echo the same thing. You need to have a trust with that you're getting all of the information from your patients. It's hard to make recommendations if there isn't that trust there. And so I think that's really important, an open conversation, asking if what you've said makes sense, if what you said sounds like something someone can live with, and if not, why and how you could change that.
Okay, so that's all the questions from our audience. So we just want to thank you again, Jennifer, for taking time out of the really busy CRAs to come chat with us today.
Thanks very much for having me.